This is a chart showing that the number of the medical workers who got infected during the coronavirus outbreak. There are 13 hospitals from top to bottom, as you can see. The first column is the confirmed cases. The second column is the suspected cases. The third column is in total. And the last column is when the first case was found in that specific hospital. As you can see that the numbers here are pretty astonishing. Think about it, 262 medical workers was infected in Xiehe Hospital alone. It's huge. I mean, it's pretty sad that the medical resources was not enough for them to get fully protected. That is why there are so many, doctors and nurses getting infected. I would say that it's unnecessary sacrifice. It's not unnecessary sacrifice, but it's sacrifice that could have been avoided, and that makes me especially sad. And if you look at when the first cases was found, they were found pretty early, in like the first half month of January, most of them. And if you see the third one, it was actually in 27th on September last year. Remember that not until January the 23rd, Wuhan was in quarantine, and not until January the 20th, Wuhan government was still trying to cover this thing up. They were still trying to convince people that this epidemic does not pass from individual to individual. They were pretending that everything was fine, but the medical workers who was treating the early cases was already getting infected. As I said yesterday, it is increasingly difficult to find the updates of both the medical workers and the patients before they get deleted online, because they're taking back their control on the grip of the censorship online. They're deleting the posts faster than before. So this is a post by someone. It says this doctor from Jingzhou, which was some place in Hubei province, he said the resources was not enough. Even those who was taking care of the ICU patients, these doctors don't have enough N95 face masks. They only get N90 masks. Basically, if the doctors got infected, they just replace them with another group of doctors. The hospitals could no longer ask for the society for donations, because these messages are considered a bad image for the government. It means that they were not doing their jobs. So their voices are muted. The questioning of the Red Cross was muted. What's going on in Wuhan was muted.